Luigi Mangione's manifesto outlines a compelling argument against for-profit healthcare.
I wanna start a revolution.
All right, guys, hello and welcome to another episode of Thinking Out Loud. Today we're going to be discussing America's new heartthrob, America's new folk hero, Luigi Mangione. This character who has obviously just taken the internet by storm through his assassination of the United Healthcare CEO. I came across his manifesto online here a few days ago, and I thought it would be interesting to kind of just free read through that. I probably won't provide a lot of analysis for it, but free read through that so you can kind of get a lens or an eye into the psyche and politics of Luigi, of this character that's just become absolutely famous overnight. But before we get into that aspect of this video, we're going to be discussing the argument for, universal health care, the argument for healthcare as a human right. And we're going to be discussing the, human cost, the very real human cost of for-profit healthcare, right? Before we jump into our articles here, into our source material, I just want to point out, a lot of why I wanted to make this video is because, say what you want to say about Luigi Mangione, say what you want to say about political violence. Obviously, we're hearing a lot of, back and forth about that. One of the things we're hearing is, this guy had a wife and family, and political violence is never right, and you have certain liberal pundits and things like that trying to paint Luigi as some sort of monster or like the next Unabomber. You're hearing all of these things, and one of the reasons why I wanted to do this video is I wanted to kind of point out the sort of double standard or hypocrisy, because the man that was at the head of that industry, this I believe it's Brian Thompson, United Healthcare, for-profit healthcare, which we have because companies like his lobby to ensure that there will never be like a single payer option, that healthcare will never be a human right. Companies like his, their profit-making motive, their business model results in the death of tens of thousands, if not hundreds of thousands of Americans every single year. And that is, as we'll see in our source material, that is not a overestimate. That is not me embellishing anything. That's the reality, that for-profit healthcare that makes people like Brian Thompson rich is built on death, mass death. So I just wanted to make this video not to necessarily condone what Luigi did, not to condone political violence, but to point out the hypocrisy of condemning the shooting of a CEO, why tens of thousands of working class Americans die every year. And if they don't die, they go bankrupt or they go homeless because they cannot afford healthcare, right? So that's what the purpose of this video is. So we're going to go ahead and jump in here to some of our source material. This first article I have here is from Fierce Healthcare. It says, universal healthcare in the U.S. would have saved 212,000 lives and $459 billion in 2020, studies find. And you're reading that right. In 2020, obviously this article, this discussion is talking about during the pandemic, when our for-profit healthcare really absolutely failed. Like, it was truly laid bare that not only is for-profit healthcare wrong, not only does for-profit healthcare bankrupt people, not only does for-profit healthcare kill people day to day due to lack of access of coverage and all these things, but in times of crisis, for-profit healthcare quite literally collapses and is incapable of doing the job that we pay more for than any other country or citizens in the world, right? So you are reading those figures right. 212,000 people, $459 billion in 2020 at the height of the pandemic. Universal healthcare coverage in the U.S. would have saved hundreds of thousands of lives, as well as billions of dollars through the first 2 years of the COVID-19 pandemic, according to a new analysis. In 2020 alone, researchers from the Yale School of Public Health and other institutions estimated that more than 131,000 COVID deaths and almost 78,000 excess non-COVID deaths would have been averted with broader national coverage. So I do want to point out, again, this is talking about during a pandemic. During a public health crisis, for-profit healthcare killed almost 250,000 people. The figures tell us that about 1 million people, 1 million U.S. citizens died as a result of the pandemic. A quarter of those people would have been potentially saved if they had proper access to healthcare. And if they were able to get into the hospital instead of putting off due to fear of bills or bankruptcy. But I do want to point out the figure 78,000 excess non-COVID deaths, because we're going to be looking at some other figures here in this video that are already pretty stark. But I just want you to highlight that 78,000 people died in 2020 due to not having healthcare not related to COVID. So meaning not related to a public health crisis, right? I mean, these are numbers worse. Okay, just one last thing here. These are numbers that are worse than war. You know, in the 20 years we were in Afghanistan, I think, 3,000 to 5,000 Americans were killed. You're talking about, and that's 20 years of war. You're talking about, we'll just count the not COVID-related ones, right? 78,000 people died because they didn't have access to healthcare in 2020. My town that I live in, not just the town I live in a small Iowa town. The town that I live in, plus the bigger town next to it, plus all the little villages and hamlets around it, because that's pretty much how it is living in rural Iowa. You got villages and hamlets with like 7 houses. That would be pretty close to everyone in this fucking area dying because they couldn't pay for the doctor. It's pretty crazy. Expanding the scope further through March 12th, 2022 brought the total number of U.S. COVID deaths resulting from incomplete insurance coverage to nearly 339,000. So you're getting close to 500,000 people. And that is from the Proceedings of the National Academy of Sciences. So that's something I want to point out here as well. Everything I'm doing here is not just from like advocacy journalism sites, like people that advocate for universal health care or whatever. They do that, but these all come from doctors and scientists that study this kind of stuff. This isn't, again, like we like to say on this channel, some left-wing rag telling you this shit. Excuse me. Without adequate insurance coverage, individuals are more likely to postpone treatment or infections due to other healthcare issues. I just highlighted that because, as some of you know, one of the reasons why I haven't been doing this channel as much the last year is because I've been having ongoing health problems, a lot of chronic pain as a result of it. And I probably maybe would have gotten it figured out by now if I wasn't terrified of going bankrupt from going to the doctor. So I went to the doctor once after like 6 months. I know, don't yell at me. I've already had a lot of people yell at me, including my mom. But, that I would maybe be better by now if I had a not for-profit healthcare system where I could just be like, oh, something's wrong with me. Let me go. But instead of that, I put it off and, it was getting better for a while. Now I'm at a position where it's getting worse again. And I'm still just scared to go to the doctor and don't, get too upset with me. I am going here this week, but just that's a personal example in my life of how for-profit healthcare has greatly diminished my quality of life and caused me to be living in pain and discomfort for a long time and kept me from doing the things that I love and that are important to me. And I know many of you watching this have similar stories. And if you don't have a personal story relating to that, you have one probably with family or people you care about, right? So it's not just deaths, it's quality of life, guys. Accompanying the estimated lives saved are substantial system-wide costs tied to preventable hospitalizations, lower negotiated rates, and reduced administrative costs. During 2019, a non-pandemic year, these factors would have contributed to $438 billion in savings. What could we have done as a society with $438 billion? We could have built thousands of new schools. We could have hired hundreds of thousands of doctors or EMTs or engineers or teachers or professors. Maybe I can't remember if I just said this, but we could have ended childhood hunger for that price tag. Like, and not just childhood hunger, like, oh, do they have enough to eat to survive? With almost $500 billion that we spend excess on for-profit healthcare, which, keep in mind, that $438 billion, it's not giving us better healthcare. It's going to these insurance companies, and they're building giant glass towers with lobbies that look like, and penthouses that look like something that the pharaohs or the emperors of Rome would have lived in. That's what that went to instead of these other things. You know, we could have fed every child good, delicious, nutritious food for probably a decade at $500 billion. Instead, we made cats like Brian Thompson filthy rich. Going on here, guys, says the U.S. COVID death total surpassed 1 million reported deaths in May. That was after a year. Researchers noted that the tally accounts for approximately 16% of the world's documented COVID mortality, even though the country only holds 4% of the global population and spends more on healthcare than any other country. 16% of all people on the planet Earth that died due to COVID died in the U.S., despite the U.S. only having roughly 4% of the world's population. We can contrast that with China's numbers. I don't even think the number of people that died in China, a country of $1.4 billion, or people, human beings, 1.4 billion human beings, sorry. They had a death toll, I believe, under 10,000. And that is because they don't have a for-profit healthcare system. They have a healthcare system that was capable of quarantining neighborhoods while still taking care of people, going door to door to provide medical care. They were able to set up overnight tent hospitals where people with COVID went to the tent hospitals instead of to the brick and mortar hospitals where people who were seeking other treatments, so you weren't having cross-contamination. That's a country of 1.4 billion human beings had like 1,000% less deaths. And that's because in China, say what you want, is China socialist or not? Is it blah, blah, blah. I don't give a fuck. It's a functioning society. It's a functioning society with at least some elements of socialism in it. Agree with me or not, I don't give a fuck. That's the reality. But because they had that functioning society with some socialist values, they were able to save probably tens of millions of human beings. Right? Because profit is not the driving motive in Chinese society. It's human development. For whatever ills or mistakes or problems that society may have. It's a society of 1.4 billion people. It's going to have problems. But despite that, they're trying to run a society and not a fucking Ponzi scheme. Crazy. Anyway, let's jump into this next article here, guys. This one's from Public Citizen, and I'll let you guys know well. Jumping in here says, nobody should die because they can't afford health care. The reality is that many people do die because they can't afford health care. And now, a new study in today's American Journal of Public Health, again, not a left-wing rag, it's a journal, scientific journal of professionals spanning the industry of health, says the numbers are a lot higher than we thought. The study estimates that 35,000 to 44.7 thousand people between the ages of 18 and 64, meaning people that aren't dying of old age or inevitable chronic illnesses that happen as a result of getting older or being young, right? There's some diseases that affect young people. Ages of 18 to 64 in the U.S., each year they died because of lack of health insurance. That's more than double the previous estimate made by the Institute of Medicine in 2002. So it's getting a lot worse. So this is putting it at 35,000 to 44,000. This is, I will highlight here, 2009. 2009. The article we had prior put the number at roughly, what was it? 78,000. So that's like another doubling, guys. That's another doubling in roughly the same amount of years, 10 years or so. So for-profit healthcare is not working. And that's the thing. That's what's so egregious and horrifying about this is the U.S. does have the best health technology and health services on the planet Earth. Not up for debate. The United States has the best quality available healthcare in the human experience, in the history of the human species. The problem is it can only be afforded by a small percentage of people. So that's what's really I don't even want to say tragic. That's what's so criminal about this. Is we have the resources, we have the material, we have the technology. $6 Million Man, to provide the best healthcare outcomes for every human being in this country. And probably more. Probably around the world. Maybe not around the whole world, but whatever. I'm getting in the weeds. But we don't do it because of insurance companies that get rich from it. Jumping back in here, guys, this is all I really have in this. It's short, but I thought this was worthwhile just to show you this trajectory. More and more people are dying as a result. The Institute of Medicine, using older studies, estimated that 1 American dies every 30 minutes from lack of health insurance. So by the time, from this old study, by the time this video is over, 1 American will have died from not having health insurance. That is for David Himmelstein, a study co-author. Associate Professor of Medicine at Harvard Medical School and primary care physician at the Cambridge Health Alliance. Even this grim figure is an underestimate. Now, 1 dies every 12 minutes. That was 2009. I wonder what it is now. I'm going to go, since we had a rough doubling, I think we would be and that we've seen the inequality get fundamentally worse, to the point where we have homeless people that have literally, we have a million homeless people on the street where medieval diseases are becoming normal again. Given all of that, I'm going to guess that now we can say 1 in every probably 7 minutes, 1 American dies every 7 minutes. So by the time this video is over, probably 4, 5, or 6 people would have died because they don't have health insurance. It's criminal. Okay. But Luigi Mangione is a terrorist or a vigilante or a inhuman, cold-blooded monster killer because he shot the guy that profits off of this. Come on. I want you to, how just the goddess Justice, the Lady Justice is depicted as having the scales and the sword, and she's blindfolded, and all she knows is the weight of justice. Let's put Brian Thompson being killed versus Brian Thompson building his wealth off the death of hundreds of thousands of Americans on those scales. Which one is a bigger crime? And you can say, well, that's false equivalency, and that's a, failure of reasoning, and every human life is valid. Okay, fine. I believe that, think that, I understand that perspective. But one of those men is a bigger criminal than the other. I don't think that's up for debate. All right, let's keep rolling here, guys. I'm trying to power through some of this because I know we want to do the reading of his manifesto at the end here. This is from Zateo. 2 26-year-olds. One killed a homeless man. Another is suspected of killing a healthcare CEO. And I want to read this article to really drive home that last point that I made. That what we perceive of justice in this country, what we perceive as right or wrong, is extremely warped due to capitalist hierarchies. In this society, we believe that one life is worth more than others. Okay? We could say that in this society would say that Brian Thompson's life, if we take the figure of annual deaths, Brian Thompson's life and quality of life is worth 78,000 of you and I. So this next article is an opinion piece. I don't want to say that say otherwise. It's an opinion piece, but I agreed with a lot of the argument that was made. I just want to point out that on top of our healthcare system, being classist, meaning that people with wealth and power get better outcomes. So is the same for our judicial system. And the entire culture of our society built around hierarchy warps the way that we view not only what is just, but in what is justice, but what is right and wrong, right? Okay, jumping in here to this reading. On Monday, 26-year-old Daniel Penny was acquitted after killing Jordan Neely, a desperate black homeless man on the subway, on the grounds that he was trying to protect others. On the same day, police detained 26-year-old Luigi Mangione, who is suspected of killing the CEO of a company that has denied thousands of life-saving healthcare claims. Sorry, I need a drink of water there, guys. Penny walks free after killing a man victim to the system, meaning that Jordan Neely was a victim of the violence the system perpetuates every day because he had mental health issues, because he had no, productive role in the capitalist system. He was cast out. That's what we do with human beings in capitalism. We either throw them out entirely or we warehouse them in prisons because there's too many of us to have a productive role. And instead of just sharing the wealth in capitalist societies and taking care of everyone, we just warehouse human beings with souls, or we throw them out into the street. As many have remarked, Brian Thompson's tenure as CEO of insurance giant United Healthcare was grisly. Thompson, alongside other higher-ups, allegedly conducted insider trading, selling millions of dollars of stock upon learning that the Department of Justice reopened an antitrust investigation into United Health. While the company was on an upward profit swing, it had been awash in allegations and revelations of conducted insider trading, selling millions of dollars of stock. Sorry about that, guys. I think something happened with this webpage where it got a little mixed up and doubled up. So yeah, as we can see with Brian Thompson here, CEO of United Healthcare, not only was he denying healthcare for Americans in order to make himself and his friends rich, he was also a insider trader, stock manipulator, corrupt. He's a prime example of not just the healthcare system, but the egregious and villainous, wow, there's some words, excesses of Wall Street that have impoverished our entire society. So great guy. I won't condone political violence, but don't ask me to mourn this guy either. While thousands have joked about the premeditated killing, celebrated it, even propped up the assailant as some folk hero, some, mostly members of Congress and the establishment media, have dug their heels, categorizing all reaction that isn't somber as vicious, dehumanizing, or even just as another example of the radical left. How dare you? He had a wife and kids. How can so many Americans be indifferent in response to death, or even celebratory in response to death? Senator John Fetterman is one of those who loudly insisted that the public execution of innocent man and father of two is indefensible. We are expected to ignore the fact that for 14 months straight before Thompson's killing, Israeli forces have publicly executed thousands, hundreds of thousands of men, women, and children in Gaza with enthusiastic support of U.S. politicians like Fetterman. Everyone that is at the top of the society is a criminal engaged daily in social murder. But because it's social murder and because it is so endemic and a matter-of-fact part of the system, we don't think of it as murder. But it is. Every politician, every CEO, every Brian Thompson son of a bitch is a murderer. A murderer. What do we do with murderers? Oh, it's okay to give a black man the death sentence in this society because he shot a cop. But if you kill tens, hundreds of thousands, millions of human beings as a result of your geopolitical or socioeconomic system, that's all right because that's just a fucking statistic. We are also expected to ignore that 2 days after Thompson was killed, 2 migrant teenagers were stabbed in lower Manhattan. The culprits who did the stabbing asked if they spoke English. The teenagers indicated that they did not. Then they were stabbed. One was killed. No manhunts for those guys. Indeed, that same day, a judge dismissed one charge against Penny, the man who put Jordan Neely, a homeless man who suffered from mental illness, in a chokehold on the subway for several minutes, killing him. Going on here, guys. How many migrants has this country really killed, either in wreaking havoc across the world and creating migrants to begin with, or in how it treats them, and they manage our cross-militarized southern border? How many tax dollars have been funneled towards endless war abroad? How many people here in the U.S. have been left without a place to call home, a pillow to return to on good days or bad ones, to the point of desperation? It's a cruel juxtaposition. The system that produced a behemoth health insurance company that haphazardly denies thousands of healthcare claims is the same that brought a homeless man with schizophrenia and depression to bounce between subway cars. Social murder, like I said. I don't condone political violence. But, like I said, don't ask me to mourn the son of a bitch. The people that run our society are fucking killing us. They are killing us. Capitalism is killing us. Running our entire society for profit is killing us. You, me, your brother, your sister, your mother, your uncle. It destroys our bodies. It destroys our minds. It sends us to early graves. And why does it do that? Does it do that because it's the best for the collective good? Because we are making sacrifices for our fellow Americans and for our families? No. It's doing that so people in glass towers in Manhattan, in Chicago, in all the major hubs of global capitalism can live a life of luxury that some studies have said rivals that of the wealth inequality of the fucking pharaohs. The pharaohs who built pyramids, great palaces for their corpse. That's the level of inequality we're in. That's why you go to an early grave. That's why you go to work sick. That's why your kids get shot in schools. That's why you eat trash food that gives you cancer and makes you sick. So that men can live like pharaohs. Men like Brian Thompson. But we're supposed to be sad that Luigi Mangione shot him in the back. That's all I have for you for article, guys. We're kind of going over time here, like usual. But I know some of you may have wanted to hear Luigi's manifesto. As I said, it's an insight into his psychology, into his politics. I know there's a lot of debate about who is Luigi Mangione across the left. Oh, is he a right-winger? Oh, he's not this perfect leftist. Oh, we should deny adventurism and spontaneous violence because that doesn't build the movement. Yes, you're right. I don't disagree with a lot of those aspects, but regardless of that, Luigi Mangione has become a hero to working class people. You don't get to decide that because you're intellectual and you read theory and because you're smarter than the average guy. He's a folk hero, and he makes a compelling argument against for-profit healthcare. Whether you agree with what he did or not, it doesn't matter. He is in the cultural zeitgeist now. Those of us on the left have a choice to completely reject that and risk alienating ourselves yet again from the working class, or we can sympathize and understand what he did and elevate the voices of other people who have suffered in pain like Luigi did, and use this as a moment to show the working class that you can resist. Right. Anyway, let's go ahead and jump into Luigi's manifesto here. Maybe I should zoom in a little bit, huh? Hopefully you guys can read that pretty well. This is from his blog, The Allopathic Complex and Its Consequences. The Second Amendment means I am my own chief executive and commander-in-chief of my own military. I authorize my own act of self-defense in response to hostile entity making war on me and my family. Nelson Mandela said no form of violence can be excused. Camus said it's all the same, whether you live or die or have a cup of coffee. MLK says violence never brings permanent peace. Gandhi says that nonviolence is the mightiest power available to mankind. That's who they tell you are your heroes. That's who our revolutionaries are. Yet is that not capitalistic? Nonviolence keeps the system working at full speed ahead. What did it get us? Look in the mirror. They want us to be nonviolent so that we can grow fat off the blood they take from us. The only way out is through. Not all of us will make it. Each of us is our own chief executive. You have to decide what you will tolerate. In Gladiator 1, Maximus cuts into the military tattoo that identifies him as part of the Roman legion. His friend asks, "Is that the sign of your god?" As Maximus carves deeper into his own flesh, as his own blood drips down his skin, Maximus smiles and nods yes. The tattoo represents the emperor who is God, the god emperor who has made himself parts of Maximus's own flesh. The only way to destroy the emperor is to destroy himself. Maximus smiles through the pain because he knows it is worth it. These might be my last words. I don't know when they will come for me. I will resist them at any cost. That's why I smile through the pain. They diagnosed my mother with severe neuropathy when she was 41 years old. She said it started 10 years before, that the burning sensations in her feet and occasional sharp stabbing pains. At first, the pain would last a few moments, then fade to tingling, then numbness, then fade to nothing a few days later. The first time the pain came, she ignored it. Then it came a couple times a year and she ignored it. Then every couple months, then a couple times a month, then a couple times a week. At that point, by the time the tingling faded to numbness, the pain would start and the discomfort was constant. At that point, even when going from the couch to the kitchen to make her own lunch became a major endeavor. She started with ibuprofen until the stomach aches and acid reflux made her switch to acetaminophen. Then the headaches and barely sleeping made her switch back to ibuprofen. The doctor said it was psychosomatic. Nothing was wrong. She needed to relax, de-stress, sleep more. The second doctor said it was a compressed nerve in her spine. She needed surgery. It would cost her $180,000. Recovery would be 6 months minimum before walking again, 12 months for full potential recovery, and she would never lift more than 10 pounds of weight again. The third doctor performed a nerve conduction study, electromyography, MRI, and blood tests. Each test cost $800 to $1,200. She hit the $6,000 deductible of her United Healthcare plan in October. Then the doctor went on vacation, and my mother wasn't able to resume tests until January, when her deductible reset. The test showed severe neuropathy. $180,000 surgery would have had no effect. They prescribed opioids for the pain. At first, the pain relief was worth the price of constant mental fog and constipation. She didn't tell me about that until later. All I remember is we took a trip for the first time in years when she drove me to Monterey and listened to Green Day on the 4-hour car ride. Over time, the opioids stopped working. They made her more sensitive to pain, and she felt withdrawal symptoms after just 2 to 3 hours. Then gabapentin. By now the pain was so bad she couldn't exercise, which compounded the weight gain from the slow metabolic rate and hormonal shifts. And it barely helped the pain, and made her so fatigued she would go on an entire day without getting out of bed. Then the corticosteroids, which didn't even work. The pain was so bad I could hear my mother wake up in the night screaming in pain. I would run into her room asking if she's okay. Eventually I stopped getting up. She'd yell anguished shrieks of wordless pain or the word fuck, stretched and distended to its limit. I'd turn over and go back to sleep. All of this while they bled us dry with follow-up appointment after follow-up appointment, specialist consultations, and more image scans. Each appointment was promised to be fully covered, until the insurance claims were delayed and denied. Allopathic medicine did nothing to help my mother's suffering, yet it is the foundation of our entire society. My mother told me that on a good day, the nerve pain was like her legs were immersed in ice water. On a bad day, it felt like her legs were clamped in a machine shop vise, screwed down to where the crank stopped turning, then crushed further until her ankle bones splintered and cracked to accommodate the tightening clamps. She had more bad days than good. My mother crawled to the bathroom on her hands and knees. I slept in the living room to create more distance from her cries in the night. I still woke up and still went back to sleep. Back then, I thought there was nothing I could do. The high copays made consistent treatment impossible. New treatments were denied as not medically necessary. Old treatments didn't work and still put us out for thousands of dollars. United Healthcare limited specialist consultations to twice a year. Then they refused to cover advanced imaging, which the specialists required for an appointment. Prior authorizations took weeks, then months. United Healthcare constantly changed their claim filing procedure. They said my mother's doctor needed to fax his notes. Then United Healthcare said they did not save faxed patient correspondence and required a hard copy of the doctor's typed notes to be mailed. That's the delaying. Then they said they never received the notes. They were unable to approve the claim until they had received and filed the notes. They promised coverage and broke their word to my mother. With every delay, my anger surged. With every denial, I wanted to throw the doctor through a glass wall of their hospital waiting room. But it wasn't them. It wasn't the doctors, the receptionists, administrators, pharmacists, imaging technicians, or anyone we ever met. It was United Healthcare. People are dying. Evil has become institutionalized. Corporations make billions of dollars off the pain, suffering, death, and anguished cries in the nights of millions of Americans. We entered into an agreement for healthcare with a legally binding contract that promised care commensurate with our insurance payments and medical needs. United Healthcare changed the rules to suit their own profits. They think they make the rules, and they think that because it's legal, that no one can punish them. They think there's no one out there who will stop them. My own chronic back pain wakes me in the night, screaming in pain. I sought out another type of healing that showed me the real antidote to what ails us. I bide my time, saving the last of my strength to strike my final blows. All extricators must be forced to swallow the bitter pain they deal out to millions. As our own chief executives, it is our obligation to make our lives better. First and foremost, we must seek to improve our own circumstances and defend ourselves. As we do so, our actions have ripple effects that can improve the lives of others. Rules exist between two individuals in a network that covers the entire earth. Some of these rules are written down. Some of these rules emerge from natural respect between two individuals. Some of these rules are defined in physical laws, like the properties of gravity, magnetism, or the potential energy stored in the chemical bonds of potassium nitrate. No single document better encapsulates the belief that all people are equal in fundamental worth and moral status in the frameworks for fostering collective well-being than the U.S. Constitution. Writing a rule down makes it into law. I don't give a fuck about the law. Law means nothing. What does matter is following the guidance of our own logic and what we learn from those before us to maximize our own well-being, which will then maximize the well-being of our loved ones and community. That's where United Healthcare went wrong. They violated their contract with my mother, with me, and tens of millions of other Americans. This threat to my own health, my family's health, and the health of our country's people requires me to respond with an act of war. And that is Luigi Mangione's manifesto. I don't want to make any real political commentary on this. I'll let you draw your own opinions on where he stood politically or whatever. Right. But I want to point out the part that really stuck with me was we have a healthcare system where Luigi Mangione had to listen to his mother scream in pain every single night. And it did nothing to help her. And at the top of the pyramid was Brian Thompson, a man who profited not just on the screams of Luigi's mother, but on the screams of millions of men, women, and children in our society. And you're going to tell me that I should give a shit about that man, Brian Thompson. That I should give a shit about the rule of law. A nation of laws. A nation of laws. The laws protect United Healthcare, not us. That is not a nation of laws. That is a nation of domination. These laws do not protect us. The police do not protect us. The courts do not protect us. That protects the ruling class. Now, an act of vengeance like this is not going to overturn the capitalist society that we live in. But I can tell you, it sure as fuck galvanized millions of Americans to this issue, didn't it? Now, I hear a lot of people talking about this was adventurism and yeah. You're right. This does not build a revolution. This does not overthrow capitalism. We need organized working class capable of carrying out a people's war. We know that. We're Marxist-Leninists. We're socialists of different stripes. We know that without an organized working class capable of making war on the capitalist class, we will not have a new society. We know that. But I know I see a lot of people quoting theory. I'll quote Lenin. In 1905, there was a series of martyrs that did acts of terrorism in Tsarist Russia. Now, Lenin did not condemn those acts. He pointed out, rightfully so, that they were acts of adventurism and that in order to build a proper movement capable of carrying out a people's war, we need to be more pragmatic. And he was right on that. But Lenin also said in that same essay, in that same publication, that those events, those terrorists, those vigilantes, ignited something in the Russian people, in the Russian Empire. This is one of those moments. And if Lenin were here today, I do not think that he would condemn the actions of Luigi. He would caution us that that is not the way we will achieve actual change, but he would herald them as martyrs and heroes of the people like he did the vigilantes or terrorists of 1905. And I'd be willing to bet my life's blood on that. Anyway, guys, we definitely went over a half hour here, but I hope you found some of this educating. I hope you found some of it poignant and galvanizing. I know that I, like everyone else in my nation, has been brought to tears in feelings of rage and empowerment by this recent incident. But I am also afraid of what this may lead to. As much as I call for and want revolution, I don't want to paint the image that I don't understand or fear what comes with it. We are in and are heading deeper into dark, terrifying times in the society, which Luigi Mangione pointed out here, that not all of us are going to make it through. But if we as a country and we as a species want to move forward into a better future where our children and our mothers and our brothers and sisters and our coworkers and our loved ones don't die due to a lack of health care, don't die to being worked to death, don't die from pandemics, don't die from being abandoned by a system that does not care about them, we are all going to have to make sacrifices. And I pray to my gods, and I pray that you pray to your God or gods, that together we get through what's coming, and that we have the strength to remain beautiful, whole human beings through the struggles that are coming. Anyway, guys, that's all I have for you. I'm starting to hurt pretty bad here, so I'm going to shut it down. Don't forget to like. Don't forget to subscribe. Catch my content on Facebook. I've now been monetized on there, so if you want to start watching and reacting and commenting on there, greatly appreciated. Don't forget you can support my independent media work with a one-time donation through PayPal at paypal.me/entitledmillennials. That'd be greatly appreciated, especially with the medical bills I know are coming on my end, so I don't end up like a Luigi Mangione. I jest. I don't know that I have the courage or the despair to do that, but you can also support my independent media work on Patreon at patreon.com/entitledmillennials. I hope to see you on there. Until next time, guys, I love hanging out with you. I love talking the issues with you again, and I look forward to speaking with you all again real soon. Bye for now.
I wanna start a revolution.